Welcome to the University of Washington School of Nursing Voices of Nursing podcast, where we dive deep into the diverse and inspiring stories from the heart of healthcare. This is Voices of Nursing. Well, hello, everyone, and welcome to our podcast for the School of Nursing. I'm joined today by Dr. Weichao Yuwen and Priscilla Carmiol. Thank you both so much for joining us today. I cannot wait to dig into some of the fantastic research work that you're doing and some of the experiences that you've had at School of Nursing. But before we do that, I would love to help our audience get to know you both a little bit better as people, because you're delightful people. I personally would love to get to know you a little bit more. So can each of you just tell me a little bit about yourself, how you're affiliated with the University of Washington?
Well, thank you for having us. I'm like a PhD student. I came to Seattle 2 years ago now. This is my second year in the program. And luckily, I'm also the pre-doctoral student from the Tornyay Center, something what makes me really proud of and thankful for as well.
Hello, and thank you for having us here. I'm Weichao. I go way back with the School of Nursing. When I was an undergrad in a different university, my advisor graduated from UW, and she was like, you have to go to UW for your PhD. That's why I came here for my PhD, graduated in 2016, and became a faculty member at the UW Tacoma campus in the School of Nursing and Healthcare Leadership.
And I'm a UW Tacoma graduate, so extra hurrah for
Yes.
that. That's very exciting. And what inspired you to pursue a career in nursing research? It's not a track that folks all the time associate with nursing. So what inspired you to go down that path?
I always been attracted to science. And since I learned, like you say, for a lot of nurses, just thinking about research is something that's not for nursing. And when I learned that we have that opportunity, I said, like, have to go for it. So there's a lot of things that nurses can do. And I think research is at least from where I come from, it's not something that nurses do that often. So that's one of the things that inspire me. Something because I really love it. And also so I can help other nurses to become researchers and move their discipline forward.
So Priscilla, you say that it's different where you come from. Mm-hmm. So what parts are different? What roles do nurses play?
Yeah, most of the nurses are like bedside nurses, mm-hmm. or they are more involved like into health management and health services. But we do perform research, but that's not something that's like, it's a rare case if you're a nurse scientist or nurse researcher. So now we're thinking that for our country to have better health outcomes and to strengthen nursing, we need to have a lot more of research and also to create that awareness in nurses that we can also be scientists, that we can also do research. And that's one of the things that also I came here, so I can go back to my country and help other nurses, like young nurses, students, so we can have a pathway in research.
And for our audience, you say you're going to go back to your country and bring some of this discipline with you. And what country is that?
I'm from Costa Rica.
Costa Rica.
Yeah, you're all welcome to visit.
Oh, I would love to visit. That's on the list.
Yeah, sure. Just wait a couple of years and then I'll have you in my home.
Oh, wonderful, wonderful. You'll have to finish PhD.
Yes, first.
Well, that sounds delightful. Yeah. Weichao, when you think about your original inspiration for pursuing the research track of nursing, what inspired you?
Yeah, so I think the idea of pursuing research came when I was an undergrad. I was doing an honors thesis around like in nursing research, and I was just intrigued by how families are impacted when someone has a chronic condition. I was a new immigrant to this country, and I'm Chinese, and in our culture, like family, I would say sometimes is the smallest unit. We don't have individuals, it's families, right? So how
it doesn't get more individual.
No, right? Nobody thinks about myself. It's always our families, right? So, but here I feel like the culture are more around individuals. So there is that cultural conflict around, family versus individual. And I lived with some of my relatives who were earlier immigrants, and they have second generation kids. And I saw the big conflict just between the two generations that are acculturated at different levels in this country, and how that impacts the mental and physical health of the entire family. So I wanted to study more. And at that time, I still remember there was a study in California that they found Asian American adolescent girls have the highest suicidal rates. And I was just very curious about why that's happening. So I continued my doctoral study looking at how, chronic disease impacts the whole family and how, vice versa. And hence my kind of family caregiving research ever since.
So bridging that generational divide, bridging that cultural divide, there's a lot to explore there. So how did the two of you, this isn't on the list, but how did the two of you find each other?
Well, that's kind of funny. It's not like very academic we had a social gathering, was hosted by Dr. Belsa. Hi, Dr. Belsa. And we were invited, and then I met with Chao, and we started talking, and we found that we have common interest. And because she's doing research with Latino population, something that I'm really interested in working too, well, we found that we were a match. And since then, I have the honor to be working with her in some of her projects. That's, I think, long story short, right?
Yeah, and I was going to Costa Rica that winter.
Oh, wow.
So when I learned that she was Costa Rican, I got so many tips. And
perfect.
10 days is not enough for Costa Rica.
I tried to give her the best tips about food.
Yes. Well, maybe we can fit in some of those tips today.
Yes.
And then a friendship, it sounds like, was born, as well as a partnership in research, which is very exciting.
Yeah.
She's also my mentor, and I'm really thankful just to meet her acquaintance, because it has led me to a new perspectives that I didn't consider for my career, and also a lot of new opportunities that I didn't thought that was going to be possible.
I'm lucky to meet you too. And I feel like as an international student, when I was in the doctoral program, I had a lot to kind of share and talk with her about, and we kind of bonded.
That's wonderful. And it sounds like you both have a lot of fun, which is always a great combination.
Yes.
So that leads us to the research, right? And you were talking a little bit about some past research areas that you both have each focused on, respectively, in cultural and also healthcare disparities that we see. So this brings me to today. So the current research that you're working on is developing technology-enabled health solutions for people with chronic conditions and their family caregivers. So you mentioned that was an area that you both shared some common interest in. So can you talk more about what these technology-enabled health solutions are, and can you share some examples?
Mm-hmm. Yes.
Yeah. I guess originally when we think about support for family caregivers, we were thinking something that needs to be very accessible to them, because whenever family caregivers have any resource, whether it's financially or time, they want to give it to the one that they're providing care for. So there isn't much for themselves. Earlier, before the current project, I was working on a project that was funded by the Sleep Center here that was developing a technology-based intervention for kids with chronic health conditions to improve their sleep and their parents' sleep. And that project, we used a web-based intervention, right? So parents would log into a website where they would do activities, learn things every week, and then improve their child's sleep. And based on that, the parents loved it. We see some improvements in their kids' sleep as well. But, the parents say, oh, it would be great if it's something that's on my phone and more accessible, right? I think that was like 2017. And that time I attended a local conference hosted by Fred Hutch and Microsoft combined. And there was a researcher who was introducing a technology called a chatbot, And at that time, I think that technology was available through like Facebook Messenger. And the intervention was for people to quit smoking. And I was like, this is very interesting. I wonder if we could do something for our family caregivers, because it's on demand right there. They can talk to someone whenever they need. So I talked with a few colleagues in my department as well as computer science, and I was like, what do you think of this idea? So the three of us, it was Dr. Dong Si and Dr. Sunny Chen, and we were like, can we build something for family caregivers using this? So we wrote a grant, internal grant to the Population Health Initiative. And we were so lucky we got funded like the first round. So we're like, okay, here we go. So
there's something here.
Yes. So since then, we've been just exploring the technologies and see whether we could support family caregivers that way.
Very exciting stuff. And now you see chatbots everywhere,
yes,
right?
Yes.
But at the time, that was a very novel usage of that particular tool. And big shout out to Fred Hutch and Microsoft as well. Fantastic to be a part of this community that we have. We have, thankfully, a lot of wonderful innovators in our ecosystem here. So my question to you is this what the future of healthcare looks like, these technology-enabled solutions? From your perspective?
Yes, I will say that we cannot stop technology in advancement. But I think like we have to be careful and really develop these innovations in healthcare, like in a very responsible way that really responds to the needs of the population. It's like have this technology and see yourself how can you use it. And if it's not clear, if it's not accessible, it's not doing that much. So I think the kind of the Weichao is doing is like really tailoring this intervention for the customers or patients' needs. So I think that's the way to go. Like you really know where the limits are of the interventions. Like you cannot expect to solve anything. Like any health intervention, it's not like a fix for everything, but it will help in a specific area. And I think that's important to know. This is our limits, this is what we can do, and also create those expectations in the consumer, I think is important, but whatever we're going to develop, it has to be in a way that really helps you. So I think the kind that work we're doing now is aiming to that the things that we develop or design are for that specific populations and their needs, not one size fits all, I think is the expression. So we're going like, this is for you and for your particular needs, just not like just like a standard kind of care, just more like how we could say like more targeted to a certain population. Yes.
Wait, how did you want to add to that?
Yeah, exactly. Yeah. And I feel like technology always change and it changes very fast. And I'm conflicted sometimes. I feel like on one side, in the past, there's research showing that it takes maybe 17 years for technology or research to be translated at the bedside. We don't have 17 years to develop a chatbot intervention. And then I don't know in 17 years what's going to be there, right? However, on the other side, like Priscilla said, we need to be very careful because new technologies, there are things that are unknown, right? Like yesterday, I was at a webinar where we talk about, okay, so there's a lot of like AI technologies that they say it's predictions, say, of a disease are better than doctors. So why are we not using them? Because they're not 100% good yet, right? So where is the line? I work with computer scientists where there are a few that they don't think we should use large language models like the ChatGPT to deliver any health related interventions because of the concerns for safety and things. And I was in this heated debate with a computer scientist. I was like, yes, I agree with you. There's a lot of considerations here. But if we were to use those technologies, it's going to be us who are thinking very carefully here that we should be the ones who are thinking and developing it, rather than maybe other people who think, oh, this is cool, let's develop a mental health bot and put it out there. There are news like that on on the internet, right? So we don't want to be that. So I feel like if we are going to use those new technologies, it's going to be the nurses who know our patients, know our families, who should be collaborating with informaticists and computer science to develop those things.
Weichao, you just brought it back around without me having to ask you the question. So I was going to ask the follow-up of why nurses, right? Why would nursing science be the particular vehicle for this type of research? But what you're saying about the harm, you both mentioned that there's this unintended consequence that could occur from using technology if you're not deliberate and cautious and intentional, right? And that nursing science brings that unique lens because someone's going to develop this technology and someone's going to use it for profit and someone may or may not have that care lens, right? And so that's the lens that you're bringing to this.
Yeah, and I think it's important that it's like an aid, not a replacement. Nurses are like behind the curtain, if you will, designing, supervising, monitoring, like training the models. It's not like we are putting our science behind the product. It's just not something that like looks nice and is up to date or following the current trends. But I think it's like it has a lot of thought and effort behind it. And like I mentioned before, like the science of nursing is, and a lot of professions or disciplines like pushing this project forward.
Love that. And you both mentioned communities that you work with. And one of the things that has been kind of out in the ether about artificial intelligence and technology in general is how do you make it more human-centered instead of just human-augmented, right? And what I'm hearing you say is there may be another layer of community-centered. So both of you have worked really hard to center community in your recent research projects, and in particular, I'm thinking of Dog Tank. So could you tell me a little bit about your experience participating in the event Dog Tank this fall, and how you've centered communities in your research? So just a little bit about that.
Mm-hmm. Well, I just recently joined the COCO team. So we still have this opportunity to present the work of a lot of people, like Weichao mentioned, from biomedics, informatics, computer science, psychology, nursing. So we say this is an opportunity to bring our project to other people so we learn about the needs of, in this case, family caregivers, that I think a lot of people relate to our experience in different ways. So we think like we're going to tell the story of someone that has experienced that and how this science, this technology can help that group of people that sometimes they are forgotten and they forgot themselves as well. And I think we had this opportunity to bring those people in the front of the stage to really share those stories and the struggles they have, and how we can help, again, like interprofessional team, how can we come with intervention or something that can help to alleviate their experience. So we say like, well, this is a good opportunity to show how technology can help, and Dr. was our perfect stage to do it.
Yeah. And I would say a lot of, say, if we submit a research grant, there are a lot of limitations of what we can do. And I think the good thing about Dog Tank is it is a gift for us to really go into the communities and build our relationships that's long-term, that's going to benefit, hopefully, a lot of the projects that we will do, right? So like this morning, we just came back from Casa Latina. Priscilla did a great kind of presentation about blood pressure, the importance of heart health, because this month is American Heart Health Month. So we're going to be at Casa Latina for 4 weeks, every week. In the morning, we talk about a different topic around heart health. So next week, it's going to be stress and eating. We'll bring some healthy snacks there. So those are great opportunities where there is not a set research goal there, but we're building community. We're getting to know folks in the community. And from there, I'm sure there will be a lot of needs that we discover with the communities. Then we can work together to develop interventions to support our communities.
where that trust comes in, where you're not quite sure exactly what's going to come of it, but you're building the trust anyway. And it's more about being connected to the community and listening with an open heart to what might arise. Yeah, absolutely. And for our audience, Dog Tank is an event that's kind of like Shark Tank, but dogs, because, huskies. And we have students, faculty present research and technology solutions, and then the audience votes, and then the top winner gets a grant of sorts where they can use it to fund their actual project. And can you just describe in a couple words what your project was this year?
Yeah, so our project was to build a long-term community advisory board that are Spanish speaking and English speaking who are leaders in our Latino communities here in Washington State, and inform us in developing technology-enabled health solutions to support our Latino family caregivers. So part of it is the Latino COCO that we mentioned. So it's a chatbot intervention to support our Spanish-speaking family caregivers. One of our collaborators, Dr. Maggie Ramirez in the School of Public Health, her work has been around supporting family caregivers of older adults with dementia. So we're hoping the Community Advisory Board can really be broad and inform just various studies that the two of us are doing, and along with our students.
More than just one study.
Yes.
So that this is a community advisory board you can go back to.
Yes. For all the ideas we have, right? Like, what if we have a long-term community advisory board that they trust us, they bring things from their community to us, and we can work together. So what we're thinking is, bi-monthly meetings with our board members to just talk about anything in our mind, what we discover in our research, help us shape, let's say, interview questions in our research, help us write grants. So all of these things so that we can reliably tap into, and there are funds to appreciate their time in contributing to the science as well.
So it's a reciprocal relationship.
Yes, I hope so. Yeah.
That's wonderful. And when we think about the long-term impacts of this work, right, we're aiming for certain types of outcomes. So how do you see this research contributing to improved patient care? What are like those concrete outcomes that you're hoping for?
Mm-hmm. I think from this project, the COCO bot, is like very focused on stress and mental health. And we know that we have within our community, we have a lot of needs related to mental health. And I think, and it's also related to a lot of other health outcomes. And I think if we can target that, it will help them to have like a better life, a better quality of life. And also, like, particularly this group of family caregivers, we know they experience a lot of stress, caregiving burden. So I think helping them to have that relief, or give them the tools so they can have like a better mental health, I think that's one of our main goals, because other pieces of the puzzle also will be moved, and then that can really improve their outcomes, I think.
Do you want to talk about the sleep piece as well?
I was going to nudge you that way, because you are doing some great work in sleep and health disparities. So yes, tell us more about that.
Yeah, well, I'm like new in the sleep science field, but I'm so passionate about it. I love sleeping. So, and
who doesn't? We love good sleep, right?
But sometimes we struggle with it. So that became one of my projects. And I always knew about health inequities. When I started reading a little bit more about sleep, learning about it, I saw that also those factors impact sleep, and how some specific groups are more affected by them. And then in my case, I've always been interested in working with migrants. And then now that I've moved temporarily to the States, I've also experienced that kind of leaving your home behind, new cultures, just the stress of getting like in a new city. And then I saw like I'm privileged to be here. I'm in a good university. I have my papers in order. I don't have that stress. So then I started realizing how all of the other components, people that don't have that, how also that impacts their sleep, the environment they live in, the chronic stress of discrimination or racism. And then that's what I like to focus my future research, principally my dissertation, how all those elements can make you have worse sleep outcomes. And sometimes we disregard sleep. It's like, oh, I'll sleep later, or that's okay, but such an important part of our health. And I think sometimes when you're struggling to make ends meet, you will like, okay, I'll sleep when I have time, or I won't focus on that. And when you start reading, it's like linked to every system in your body, to a lot of processes that you don't know. Like if you have a bad sleep, it will also affect other health outcomes. So I want to work that, and also to hopefully in the future create interventions that can help people to have a better sleep, and that will also translate into have a better quality of life and other health related outcomes. Yes.
Great.
Phenomenal. Did you want to add anything to that?
Yeah, and just I feel like doing those projects are also meaningful in the way that we have members like Priscilla. Our team also have two other, I think, second generation Latino students or recent graduates from UW in our study as our research assistants, research coordinators. And, one of them are from the Eastern Washington area. Their parents are from the migrant farm workers community. I feel like I'm equally inspired working with them and as, working for our Latino communities, just inspiring them. They're thinking about grad school, doing public health, nursing work. So those things are very meaningful as well.
It's particularly meaningful that you have folks who are part of these communities conducting the research and being in that position of power, because historically, we have had a lot of the lenses from, a particular lens of white, male, middle-aged people conducting research. And so it's wonderful to see a more co-creative approach where the lens of the community is represented just inherently in the research. It's not something that's an afterthought.
Mm-hmm. Yeah, and I think it's also that's what I like of forming this community advisory board, because we can listen to other people's experiences. We can give voice to others because, my experience could be very different to another, comes from my same country. So I think if you have a variety of voices, that will make for us to have better understanding of the needs, and like you said, distributed power.
Distributed power.
So I think that's something that having this approach to develop interventions, to develop research, is a strength of the project, I think.
Absolutely a strength, and that unique lens of care, of nursing, of community, that really shines. What advice would you give to aspiring nurses who might be interested in research?
Do it.
Do it.
Do it. Yeah, it's never too late. I'm an example of that. I'm maybe a little bit above the average of people doing PhD, but I think if you have the passion for it, you have to give it a try. The best thing that you can say, if you apply to a program, is no, but the best is they can say yes. So give it a try, I'll say.
Don't say no to yourself.
Yes, exactly.
Make other people say no.
Don't be your first barrier.
There you go. Yes.
Yes.
Love that. And Weichao?
Yeah, and I would say believing what you believe in and do what you would like to do. And it might not be the next day that you'll achieve your goal, but in my case, it's been 10 years and I'm finally, I feel like having the resources and knowledge and the support that I'm able to do the work that we're doing now. It takes a long way to go, but it's very worth it. And maybe a little bit of advice is to connect with people, right? So connect with colleagues from different backgrounds. We together with the same goal, then, we each have a different perspective and knowledge and skills, then we contribute to the greater good of what we want to do.
Oh, love that. And I see that connectivity between the two of you, right?
Yes.
But find your people. Find the folks that can help you. Build
Yes.
community. Absolutely.
I cannot do it alone.
Mm-hmm.
Yeah.
Fantastic advice. Well, thank you both so much for joining us today.
Thank you.
It's been an absolute pleasure. I hope that we'll have you back again in the future to talk a little bit more about how research is progressing.
Thank you.
And maybe we can talk a little bit more about those trip tips.
Sure. I have like a script already.
Oh, perfect. Perfect. Thank you for tuning in to University of Washington School of Nursing's Voices of Nursing podcast. Join us next time as we continue to explore topics vital to nursing, health, and well-being. Until then, stay informed, stay inspired, and stay engaged. And don't forget, follow Voices of Nursing wherever you listen to your favorite podcasts so you'll get every show as soon as it's released.